My name is Barbara Rosenberg. I'm with ElderWorks. I'm one of the senior care consultants. What we all do is we help people figure out if they want to move from their home, how to select an independent living, assisted living, memory care, or skilled care community. We're also the portal for a lot of community resources. We put out a senior directory at ElderWorks. That directory is a paper directory. It will be published again this spring. It also is online at ElderWorks, ELDERWERKS.org. Lots of questions and answers in there about, durable medical equipment, to Medicare, to Medicaid. It lists a lot of attorneys and senior designated realtors. So it's a very good resource directory. Any questions that anyone ever has, you can always call one of us through the office, 847-462-0885. I'll put that in the chat. Certainly my personal cell as well. And we are a not-for-profit as a 501c3. We appreciate donations at any time to our organization to keep us running, because we are such a resource to all of the communities. And we have partner communities all throughout the state of Illinois. Today's event is being recorded for Facebook Live, and I will go ahead and introduce Chris Petrick, our nurse, discussing how to stay heart healthy and the importance of avoiding hypertension and heart-related issues. Certainly in this pandemic, we're all going through so much, and it's very important to do whatever you can to take good care in terms of your diet and your exercise. So I'm going to go ahead and take myself off camera. Chris, thank you for being here. Emily, thank you for being here and helping us as well. And welcome to you, Martha and Inez. And if anyone else pops on. At the end, if you have questions, put them in the chat, or we can talk casually, whatever you feel.
All right. Thanks, Barbara. As Barbara said, my name is Chris Petrick. I'm a registered nurse. I am the training specialist for ElderWorks. I've been with ElderWorks going on 2 years. I'm retired from my full-time job as a nurse. It was a perfect time to retire, I guess. But I've spent 40 years in healthcare. My experience is quite varied. I started my career out in labor and delivery and did 20 years of that, and then went into teaching and med surg and just did a lot of different things. Last 15 years, I ended my full-time career in geriatrics, where I served as manager and director in different communities of training and development and training and education. And my goal was to train people so they were better at the bedside with our residents. I am certified in dementia. That's my passion. And but today we're going to talk about staying heart healthy. Just so you know, Ask the Nurse is done once a month. It's always done on a Thursday. I have topics that I select unless someone says, I'd really like to hear about such and such, at which time I will do any research that I need to do on the topic and do a presentation on it and give you some information. This is clearly not healthcare advice. This is clearly informational. So at this point, I'm gonna take myself off of video, and I'm gonna ask everyone else to do the same. And all you'll see, all you'll hear now is me, because I like to take myself off until questions start so you can see the slides clearly. So we're going to talk about heart healthy today, and February is American Heart Association month and staying heart healthy. There's a lot of different reasons that people have issues with their hearts. Sometimes it's congenital, which means they're born with it. Sometimes there's a malfunction of a valve. Sometimes because of infections and other insidious conditions, you may have something called heart failure. So there's a lot of different reasons people have heart issues. I'm going to focus today on one of the things that you can do to prevent heart issues, and that is high blood pressure. So hypertension is nearly 1 in 2 people in the United States have hypertension. Unfortunately, only about 1 in 4 of those people have it under control. Some of these slides I got from the CDC because they run a whole program through the month of February. And you can go online at cdc.gov/heart month and pull up any information that you want about hearts, how to make your heart healthier, and hypertension. African American adults are more likely than white adults to develop high blood pressure earlier in life. And again, for anybody that falls into that category, you can go to cdc.gov/blood pressure and take a peek at what that has to offer you as far as education. We'll talk about minority groups and why they're more at risk for hypertension. So did you know that high blood pressure can affect the body in many ways? And again, there's lots of tools in there for you, but this just pulls up some of the things that it does do, and we'll talk about those in a minute. But you can have issues with cognitive decline, you can have issues, heart attacks, strokes, eye problems, sexual dysfunction. There's just a lot of issues, and we don't even think about those from day to day, how they can affect us. So what is high blood pressure? What is hypertension? Blood pressure is the pressure of your blood pushing against the walls of your arteries. And the arteries carry blood from your heart to other parts of your body. Your blood pressure normally rises and falls throughout the day. And there's a lot of different reasons that it elevates and then it goes back down. But what do those numbers in your blood pressure mean to you? There are 2 numbers that we talk about in blood pressure. The first one is what we call the systolic blood pressure. And that measures the pressure in your arteries when your heart beats. That's the systolic, is the pressure in the arteries when your heart beats. The diastolic blood pressure, which is the lower blood pressure, the lower number on the blood pressure, measures the pressure in your arteries when your heart rests in between those beats. And if I had to tell you there was one that's a little more important than the other, that's the one that is. We look at that diastolic blood pressure all the time, but they're both extremely important. If the measurement reads 120 systolic and 80 diastolic, you would say the blood pressure is 120/80. What is a normal blood pressure? A normal blood pressure is less than 120/80. Doesn't make a difference of your age. You can take steps every day to keep your blood pressure in a healthy range. What do we consider hypertension or high blood pressure? That's your blood pressure that is normal, higher than normal. Your blood pressure does change throughout the day based on your activities. So having blood pressure measures consistently above that normal range may result in a diagnosis of high blood pressure or hypertension. The higher your blood pressure levels, the more you are at risk for other health problems such as heart disease, heart attack, or stroke. Your healthcare team can diagnose your high blood pressure and make treatment decisions by reviewing your systolic and your diastolic blood pressure levels and comparing them to levels found in certain guidelines. And I will tell you that the guidelines used to diagnose blood pressure may differ from healthcare professional to healthcare professional. In some healthcare professionals, diagnosing patients with high blood pressure would be if their blood pressure was 140/90 or higher. This limit is based on guidelines that was released in 2003. But in 2017, they released different guidelines, and some healthcare professionals go along with that guideline, and it's 130/80. So, that's the difference in blood pressure readings, and we can talk about that at the end if you have any questions. So what you don't know about hypertension can really hurt you. High blood pressure affects nearly half of the adult population in the United States, but many people who have that condition don't know they have it. Uncontrolled high blood pressure raises the risk for heart disease and stroke, which are leading causes of death in the United States. Fortunately for us, high blood pressure is treatable and preventable. So a couple of things that you need to know is high blood pressure may be linked to dementia. Recent studies do show that high blood pressure is linked to a higher risk for dementia and cognitive function changes. Timing seems to matter. Evidence suggests that having uncontrolled high blood pressure during midlife, which we consider 44, to 66, creates a higher risk for dementia later in life. What's the takeaway on this? It's never too early to start thinking about your blood pressure and taking steps to manage your high blood pressure. I have a son who's 40. He just turned 40 last summer. And when he went for his physical, and he's the type of guy, like many men, that think going to the doctor is ridiculous. They don't need to go, even though his mother's a nurse. He doesn't listen to what I say on that. And when he was found that his blood pressure was borderline, he kind of laughed and joked about him. And I said, this isn't funny. And this is going to get worse if you don't manage it. So he has a very sedentary job. He is an animator and a cartoonist. He writes children's books. And so the first thing he did was get a standing desk. And he uses that so he can stand, because standing is better than sitting. They say sitting is the new smoking. So sitting does a lot of damage to your body as well as your heart. So, get up and move. They got a dog, so he's the one that walks the dog twice a day. So he's implementing some of those things that we'll talk about. But, it's hard to tell people at that young age that this is a serious problem. High blood pressure, like I said, doesn't just happen to older adults. Nearly 1 in 4 adults aged 20 to 44 have high blood pressure. Sometimes it's genetic, sometimes it's related to medication they're taking, sometimes it's due to a disease process they may have, like someone who has, who might have, I can't think of the name of it. It's a kind of cystic disease of the ovaries. Younger women tend to have this. And along with that goes high blood pressure. And they don't know the correlation, but there is hypertension related to ovarian cystic disease. We do know that high blood pressure is a leading cause of stroke, a condition that is on the rise among younger people. And experts think that the increased risk for stroke in this age group is a direct result of the rising rates of obesity, high blood pressure, and type 2 diabetes. And those are conditions that are preventable and treatable. We just have to reach these people and tell them how important it is. So if you think you are at risk for having high blood pressure, you really need to reach out to your healthcare provider and let them know. High blood pressure usually doesn't have any symptoms. That's why it's called the silent killer. Most people with high blood pressure don't have any symptoms because many people feel fine. They don't think that they need to get their blood pressure checked regularly. So even if you feel normal, your health may be at risk. So again, monitor that and make sure that your blood pressure is below those norms. Many people who have high blood pressure, many people in that, the two subgroups, women and African American face unique risks when it comes to high blood pressure. Women with high blood pressure who become pregnant are more likely to have complications during their pregnancy than those with normal blood pressure. So again, for the younger woman, that can be a danger. And again, that can cause problems with the kidneys and organs and can lead to premature delivery and low birth weight babies. And we do know that some type of birth control can put a woman at risk for high blood pressure. We also know that African American men and women, like you saw in that first slide, have higher rates of high blood pressure than other ethnic groups. These individuals are more likely to be hospitalized for high blood pressure, and they think that they're more at risk because they're underserved. They don't seek health care Frequently, they, have a higher incidence of obesity, high blood pressure, and smoking. So again, we'll talk about lifestyle, putting you at risk. So hypertension in itself puts you at risk for heart disease and stroke, which is the leading cause of death in the United States still. Even COVID is very, very close behind it right now. In 2018, nearly 500,000 deaths in the United States included hypertension as a primary contributing factor. Nearly half of adults in the United States, about 100 million, which is about 45%, have hypertension defined as a systolic blood pressure of over 130 or a diastolic blood pressure of over 80. Or they're taking medications for hypertension. Only 1 in 4 adults with hypertension have their condition under control. About half of the adults, 45%, with uncontrolled hypertension have a blood pressure of 140 over 90 or higher. This includes 37 million US adults. About 30 million adults who are recommended to take medication may need it to be prescribed and start taking it. But there's a large group of those people who are diagnosed that don't take their medication or don't take it on a regular basis. Uncontrolled high blood pressure is common. However, certain groups of people are more likely to have control over their high blood pressure than others. A greater percent of men, let's say 47%, have high blood pressure, have a higher blood pressure than women. Higher blood pressure is more common in non-Hispanic Black adults, about 54%. And then, we talked about the African American. I do want to mention there are 2 types of blood pressure. There's something called primary blood pressure, or what's called essential high blood pressure. And it is the most common type of blood pressure for most people who get this essential or primary blood pressure. You develop it over time. Having lifestyle choices that don't bode well for hypertension can put you at risk for high blood pressure. And then there's secondary high blood pressure that can be caused by other medical conditions, like I said, like polycystic ovary disease, or taking medications such as prednisone or other steroids can elevate your blood pressure. So again, if you have any of those conditions or there's a list of other conditions that can elevate your blood pressure. But if you have any conditions that may put you at risk, you do need to have your blood pressure monitored. Whoops, sorry about that. So what behaviors increase the risk for your high blood pressure? These are things at the top, and I'll stop when I tell you that you have little or no control over it. But first of all is your unhealthy diet. You should be choosing foods that are looking more towards the Mediterranean diet. You want to choose foods that keep your cholesterol under control. You should have a diet that's high in protein. You want to make sure that you're keeping your potassium levels high, because it's found that people with low potassium levels have a higher rate of hypertension. Physical inactivity is a driver for increasing your blood pressure. And again, it's very difficult in this pandemic, and even twice as difficult to get out in this sub-zero weather. So it feels like, the odds are against us. But, if you have a Fitbit, or you have something that monitors your walks every 20 minutes or so, you should get up out of your chair and at least walk around your house. Obesity is another driver for hypertension, and about every 10 pounds that you lose, you're going to bring down your blood pressure. So if you're in the process of losing weight, good for you. If you're thinking about it, I would probably give it, if you have hypertension, give it more consideration. It might be at some point that your primary health care may decide to lower your dose or change the dose because you're losing weight. So if you're on a weight loss program and you're taking medications, be in contact with your healthcare provider, because at some point you may or may not have to have changes. You may not be able to change, because it might be driven by your hypertension, might be driven by something else. Tobacco use, we know that smoking increases blood pressure. So if you're smoking, consider options on way to stop smoking. And then too much alcohol. You know, a glass of red wine every night is not a bad way to end your day, as long as you're generally healthy. But if you are, having more than one drink per day, and really you need to look at what is too much alcohol for you. Again, I'm not advising anybody on stopping smoking or too much alcohol, reducing your alcohol. But what I'm saying is, if you have either of those in your lifestyles, you may want to reach out to your healthcare provider and ask them questions that would help you decrease the use of both of those. Now, here's where you don't have a lot of wiggle room in your risks, and that is genetic and family history. I'm essentially a healthy older adult, and back in my 40s, my blood pressure started elevating, and of course I wasn't going to take the blood pressure medicine because it was just a fluke, and if I lose a few pounds, but I thought about it, and I thought, well, if I was a diabetic, would I take insulin to keep myself healthy? Of course I would. So I obviously decided that would be the best way to go, is to take this blood pressure medicine. Because looking at my family history, it dawned on me that both of my parents had hypertension. So I had a strong enough family history to think about that. Age, as I said before, age tends to, as our body ages and our smooth muscles and our arteries change, so does the pumping of our heart and our blood flow. So some people will have hypertension. That does not mean it happens to everybody. My husband, who's 73, just went for a physical the other day, and his blood pressure, and he takes no medicines, is 120/62. So he's in that healthy range. He's got good genes. His dad never had a high blood pressure problem until he was 88. So again, good genetics in his family for hypertension, bad genetics in my family. And then sex, we know that males tend to have higher blood pressure than females. And then, like I said, ethnicity, we know that with ethnicity in our different cultures, in our Hispanic and our African American, they tend to genetically have higher blood pressure, but also it could be lifestyle and lack of health care. So those are some of your risk factors for high blood pressure. Things that you can do to lower your blood pressure. These are really important. Again, like I said, eat healthy. You wanna stay away from those really severe diets like the Atkins diet. You wanna make sure that you're eating a nice portion, but you wanna make sure that your portion of protein is a little bit bigger than your portion of carbohydrates. A lot of people go on no or low carbohydrate diets, and then they start to feel foggy. And that's because carbohydrates will feed our brain also. So you need those carbs, you just don't need a lot of them. You need to make sure that you look for a healthy diet. And if you go to the CDC Heart Health /.com, you will find recommendations for eating healthy. Exercise at least 3 days a week for 30 minutes. The new information on exercise and for people who want to reduce their risk of dementia is you should break a sweat in that exercise 3 times a week, whether it's walking or low impact, but you want to get your heart rate up a little bit and you want to exercise. And you can do that in chair exercises as well. If you're not breaking a sweat, you need to at least exercise 3 days a week for 30 minutes. Now, if you have bad knees or bad hips and you can't do something for 30 minutes, break it down into 2 15 minutes or 3 10-minute walks a day. So you can break that exercise up, but it's really the getting up and moving. Like I said, avoiding excessive alcohol and stopping smoking if you do. Increase your water intake. You know, dehydration is the #1 reason that older adults end up in the emergency room. They may go there because they're confused or they fell or they hit their head. And really, when you question them and you say, how much water did you drink today? They didn't have any water. So you need to increase your water intake. You need to eat more foods that contain potassium. And again, that can be found on the web. Take your blood pressure regularly. What I suggest, and I tried to download it into this PowerPoint for you, is a chart that you can use to monitor your own blood pressure. You really want to take it, you know, around the same time every day, or if you're going to take it twice a day or once a day or every other day, kind of follow that routine. But you want to make sure that you're taking your blood pressure. And then seek help from your healthcare provider for diet, medication management, and management how to stop smoking and decrease your alcohol intake. Now, this is what it should look like if you're taking your own blood pressure at home. You really should have your arm on a flat surface, and it should be level with the level of your heart. You want to have your back supported, and very important, you want to have your feet flat on the floor. If you have your legs crossed when you're taking your blood pressure, it's going to be higher. So take a deep breath before you take your blood pressure, and then go ahead and start the machine. Your cuff should be against your bare skin, and your back should be supported so you're not leaning forward. That puts more pressure on the heart. And then, like I said, sit with your feet on the floor. Let me go back a second and tell you, if you're going to take your blood pressure at home, ask your pharmacist what the best blood pressure kit would be for you. You know, I have something very similar to that, and that is a good baseline. However, there were when I was initially put on prednisone for a condition that I have, and prednisone is one of those medications that lowers your, or I'm sorry, that elevates your blood pressure. I noticed that my it started going up. Okay, it looked like it was different from what the baseline was. And some of them were kind of crazy. So, you know, yes, are those 100% accurate? Not always. Sometimes they do have malfunctions. Because I'm a nurse, I have a blood pressure cuff at home. And with the assistance of my husband, I took my own blood pressure and did it on a regular old-fashioned blood pressure cuff for a while. And indeed, it was elevated, so I needed to call my doctor. So you may not have a regular blood pressure cuff at home. So what I'm saying is that if you're using the thumb one or the wrist one or one like this, and you start to get some blood pressure readings that are not the norm, you need to have it checked out. You can go to your pharmacy and get your blood pressure checked. You can call your healthcare provider and go in for a blood pressure check. So there's different ways that you can monitor that. And again, you can use just a sheet of paper to document that. But if you go to the CDC.gov blood pressure, there is a nice little sheet that you can monitor yourself. So what's your reading? What will affect your reading? If you're nervous about having your blood pressure taken, sometimes what you ate, drank, or did before your reading, you know, again, I noticed my blood pressure was going up. And when I recognized what I was having popcorn about an hour before I ate, and there's a lot of salt on the popcorn. So I had to look at that and say, you know, if I'm going to take my blood pressure, I probably shouldn't have popcorn. So sometimes there's a lot of sodium in something that you ate or drank, you're going to see that blood pressure reading go up. And then how you're sitting, again, cross legs slumped over, or your arm is below the level of your heart, you're going to have some issues. So there's a lot of different blood pressure medications out there. That could be a whole topic for another day. But I will tell you the primary ones that you'll see are called beta blockers. And there's others that, let me see how I want to approach this. So actually, blood pressure medicines can affect the heart differently. It can relax your blood pressures. It can make your heartbeat work with less force, or it can block that nerve activity that restrict your blood pressures, restrict your blood vessels. I'm sorry. So again, your healthcare provider is going to decide what kind of medication that you take. All medications, and along with blood pressure medications, have side effects. And so it's important that you read those side effects when you get those medication pamphlets. Don't just throw them in the trash. Look at some of those side effects. And if you have some of those side effects, you need to call your doctor. They can certainly try another one. I remember when I first started my blood pressure medicine, they started me on a medication called lisinopril. And that's called an angiotensin medication. And I started coughing, and I didn't even put 2 and 2 together at first. I just started having this tickle, and I thought, oh, it's allergies, but it became more and more pronounced. And then someone said, it might be your blood pressure medicine. And I thought, light went on, and I thought, yeah, so I looked it up. And one of the first couple of things it says is a dry, hacky cough. So I called my physician, and they put me on a different kind called a beta blocker, and it was fine. So again, look at those side effects. If you have any issues, you need to call your healthcare provider. The last thing is you probably need to talk to your healthcare provider about what they call the ABCSs of high blood pressure. And again, this is only informative. This is not advisory in any way. Some doctors will prefer that you take a daily aspirin. Again, it depends on what other medications you're taking, because obviously if you're on medication that decreases your clotting time, adding aspirin to that would not be a good idea. However, studies have shown that some people who take aspirin have a lower rate of heart attacks. And some studies even advise, if you think you're having a heart attack, to take aspirin. Again, this is not advisory, just informational. So I would talk to my healthcare provider about it. Blood pressure control, again, extremely important to monitor that. Another thing that will help control your blood pressure and heart disease is cholesterol management. So, make sure you're going for your annual physicals and look at your cholesterol and have a talk to the doctor about it if it is elevated. And then again, stopping smoking is very important. So that really is the end of what I have to offer. And I thank you for joining us today. And I will take any questions.
Anybody have any questions in the chat of all our participants and those that came on? Jack, Marcia, you're new to us. Any questions, any comments? So much information. Welcome to everybody else that I didn't get to greet in the beginning. We appreciate your being on here. And
this is Martha Sanka from Summit Park. I just want to say thank you very much for offering this workshop. It was very informative.
Oh, thank you, Martha.
It was so informative that I don't have any questions, but thank you very much.
Good, and thank you. I appreciate that. All my information for today's Ask the Nurse was provided from cdc.org. And if you do have any questions thinking about it later, go ahead in there. They have some interactive things. Again, they.
Can you put that can you put that in the chat so we could copy that?
Sure.
Or will you email us that information to keep it for reference?
Sure, let me put it in the chat. And
thank you.
It is.
And I'm going to mute myself again. Thank you.
That should do it. CDC.gov hypertension or high blood pressure. So actually, when I went to the CDC website, and it was on the front page because it is American Heart Month. February is American Heart Month, so they do a big splash on it. So it's a great reference.
We have a, thank you so much, Chris. This was amazing. We have a complimentary caregiver symposium coming up February 15th from 9 to 5. If you want to register, it's still not too late. You can call our office, 847-462-0885. If you want to sign up for the caregiver symposium. And I know you're all on our list for our consumer events. So, we appreciate that. And for those that weren't on in the beginning, again, I'm Barbara Rosenberg with ElderWorks, and we help people find the right senior living or home care. We're partners with most of the companies all throughout Illinois, and we don't charge for our services. We are complimentary, all of our referrals and any advice you need. And if you look online at ElderWorks, ELDERWERKS.org, you can see our directory. The 2020 directory is in there, but the 2021 will be coming out and will be available at our center sometime in the spring shortly. So anyway, Chris, thank you for your time.
Thank you.
We are grateful for all of your information and your beautiful slides. And everybody have a wonderful day.
Stay healthy, everyone.
Stay healthy.
Bye-bye.
Have a great Valentine's.